Hi, welcome to class. My name is Ellen McKay, and I'm here with Yoga for Caregivers and Caregiver Whole Health to hopefully bring a little relief to your low back. Especially as caregivers, we are doing a lot that puts pressure on this low back space. Whether we are lifting our care recipient, we are sitting in doctor's offices, we are lifting and moving and cleaning and all of that comes along with being a caregiver. And sometimes we don't even get any rest until we lay down to sleep at night, and then our body is saying, I'm not ready for rest. I need to move and relax a little bit. So here's something that can you can either add into the end of your day. This will be a nice, gentle practice, so it won't require a lot of energy. So it's good for kind of end of day, winding down, getting ready for sleep. Or if you've got a few minutes in the middle of your day, if your care recipient is napping or doing something that you can kind of take a little time for yourself, this is a good little 15-minute practice to unwind the low back. So I'm going to be practicing on a mat here. If for any reason coming down to the floor doesn't feel great for you, you can practice this on a bed or a couch. But the more firm you can find, the better. We want to have some support there for the back. So I'm going to come all the way down to my mat. Feet are going to be on the floor, knees are going to be bent. Let's just find a little bit of breath first. If it feels okay for you, hands can come to your belly. Starting out, just bringing that awareness to your inhale and exhale. Maybe you can start to feel that shift in your breath from the chest and kind of upper lung breathing to more of a diaphragmatic breath, or feeling that belly rise and fall. If it feels okay for you, maybe even on your exhale, starting to engage those abdominal muscles a bit. Just kind of hugging that breath out a little. Good. Inhale, just natural inhale, filling those lungs back up. Exhale again. Maybe engaging those lower abdominal muscles with the sound of shh, and those upper abdominal muscles with the sound of grrr. Good. Full and complete inhale. And let's try that one more time. Exhale. Shh, grrr. And when the body's ready, inhaling back to center. Good. We're going to stay in this position, knees bent, feet on the mat, and we're just going to start with a little bit of pelvic tilts. So all I'm doing is tilting my pelvis anteriorly. So all that means is I'm going to dip my tailbone down towards the floor and my low back lifts a little bit. And then I'm going to press my low back down and tilt my tailbone up a little bit. So the back doesn't come up off the mat. We're just kind of tilting the pelvis forward and back. Good. And as you do that, you might notice the head also tilting along with the pelvis. That's normal. Just kind of let the spine move and follow along with this tilting. Good. Few more tilts. Nice. Good. Soften that and just pause in stillness for a few breaths. Maybe again adding that extra exhale, using those abdominal muscles to press that breath out. Inhaling fully when you're ready. Good. Nice. From here, let's start to unwind some of those back muscles as well as legs. So glute, thigh, low back, all are pretty big muscles. They do a lot of work for us, and sometimes it can be hard to stretch those muscles or release those muscles without doing a lot of work. So shaking is one of the easiest ways that I have found for myself to unwind that space. So lying on your back, staying in the same shape, we're going to keep the left leg down and we're just going to lift the right. It doesn't have to be straight. You can bring your hands behind here or maybe a strap if that feels like it's too much to hold on. You don't have to hold on at all. We're just going to shake that leg. So however you can shake that leg, let it shake. Good. You can let the foot be floppy. You can flex the foot. Again, it's really up to you. Ideally, we would take about 1 minute per side. So we're going to give that a try. If at any time you want to just release that leg down, go ahead and find your breath. We'll take some time to pause anyways at the end of this. So we'll just meet you there. Good. We're almost done anyways. Keep that shaking going, and you can move that leg around as you shake it. You can move it down towards the floor or out to the side or anywhere you want. Good. Another couple breaths. Shake, shake, shake. Fantastic. Bring that leg down. And just observe. Notice how that side feels. Take a few breaths. Great. Let's give it a try on the other side. So when you're ready, right leg's going to stay stable, left leg's going to lift however you want it to, and start that shake. Shake, shake, shake. Same as the last time. Upper body doesn't have to do any work. So see if you can soften shoulders, hands, neck. Good. Again, you can kind of move that leg around however you want. We'll try to stay here a minute, but you can release whenever you want. Good. Again, foot can be floppy, or you can flex the foot and kind of kick the heel. That can get a little more into thigh, hip, glute space. Good. That floppy foot might get a little more into calf. You got it. Almost there. Breathe, breathe. Good. Couple more shakes. And then let that left leg come down. Again, just observing. And try to observe without judgment. Good. So just doing those pelvic rocks and leg shakes, awesome way to kind of set the body up for more peaceful and restful sleep. If you want to add a few more movements, we're going to take those feet as wide as your mat. If you're not on your mat, take your feet wider than your hips. And we'll start some internal and external rotation. So drop one knee down and then the other knee down. So we're just kind of slowly shifting those knees side to side. They don't have to go as far down as mine. Maybe it's a bit smaller movement for you because that's what feels really nourishing. So as always, just do what feels good, right? Especially if this is before bed. We're trying to unwind. We're trying to get ready for rest. No need for extra pressure here. Good. Few more side to side. This helps to open up that outer thigh, hip space. Good. Come back to center. Gently roll onto one side. And you can just bring your forearm down to bed, mat, wherever you are. This is a great little twist and stretch. Again, just to elongate the body, to unwind any tension or holding on that you might feel, especially in that low back and hip space. So as you're on the side here, we're going to take our top leg. So I'm on my left forearm, right leg is on top, right arm is on top. I'm going to kick my right leg behind me and reach my right arm forward, kind of on a diagonal. So those right fingertips are reaching towards maybe my upper right hand corner of my space, and that right foot is reaching back to that lower left hand corner of my space. Stretch, stretch, stretch. Reach fingertips and toes away. Good. Slowly bring everything back to center. Just take a pause. And let's do it one more time. Reach that right hand to that upper right corner, right foot to that back left corner. And bring it all back to center. Nice. You can just roll right onto your other side. I'm going to stay facing you so you can see me. But now my weight is on that right forearm. And we're going to do the same thing here. So my left arm, left leg are on top. I'm going to kick that left foot back like a diagonal and reach those left fingertips forward. Belly and chest might turn a bit towards the floor. Finding your twist. Good. Gently unwind, bring it back to center. Take a pause. And let's do it one more time. Reach that left leg back on that diagonal, left fingertips forward. Great. Bring it all back to center. Let's come back onto the back. Knees can stay bent, or maybe hug the knees into the chest. Give that low back one more little massage. Nice. Exhale, bring the legs down. Either keep the knees bent. That might feel better on your low back, especially if it's feeling a little tight. You can also take pillow blankets underneath the thighs or the knees. If you want, you can bring the legs straight. That's completely up to you. Gentle, restful breaths. Feel free to stay here as long as you like. Thank you for practicing with me today.